My name is Emma Nye. I'm a doctorate in athletic training student at Indiana State University, and I'm going to talk to you a little bit about the disablement model and how it relates to injury prevention and health-related quality of life. Throughout this presentation, we will make reference to disablement model, particularly the World Health Organization International Classification of Function model. Additionally, throughout this presentation, we will make reference to a female basketball player with an ACL tear, which we will use as an example. The disablement model has been recommended for use by clinicians and researchers alike as the framework for clinical practice and research. It's a 5-step model, the first being origin. The origin is the health condition, in our example an ACL tear, also coded as S83-512A on the ICF. The next stage, organ. This can be further broken up into body structure and function and mental and physical aspects. In our example, decreased strength and atrophy for the female basketball player. The next stage is the whole person, and also broken into activity or a task that has meaning performed in the environment. For our example, the inability to jump. The next stage, societal, has an aspect of participation which has a component of performance, similar to activity but applied to life. So our example, social events with peers. And finally, environmental, broken up into relationships, attitudes, and policies. For example, the athlete's relationship with the athletic trainer, whether positive or negative. And also personal, the age and education. So now that we have a framework for the disablement model, we can move into risk factors. And keep in mind throughout the risk factor portion of this presentation, those 5 steps we just discussed. Risk factors can be broken into biological, environmental, and behavioral, and further into modifiable and non-modifiable risk factors. Modifiable risk factors can be changed. In our example, the athlete's muscle imbalance, or BMI. Non-modifiable risk factors are not amenable, like Q angle and injury history. Now, the first step in injury prevention is identifying these risk factors associated with injury. Modifiable and non-modifiable risk factors allow clinicians to target individuals with more immediate and pressing needs. Once we have identified these risk factors, we may move into prevention. We're going to talk about 3 general approaches to injury prevention: primary, secondary, and tertiary. Now, the athletic trainer's goal is to mitigate the burden on health-related quality of life through prevention. Primary injury prevention focuses on the healthy individual, reducing susceptibility and controlling exposure. For example, a preseason jump landing mechanics program for those athletes who have not sustained an ACL tear yet. Now, relating back to the model, primary injury prevention can be directly related back to the organ and origin of our model. Secondary injury prevention focuses on early detection, reducing risk factors, and education, like the athlete's BMI, which can be related directly back to the person or activity level of the disablement model. And the last step, tertiary injury prevention. This is slowing progression and reducing secondary conditions of athletes who already have the condition. So for example, our athlete has sustained an ACL tear. We may perform preoperative rehabilitation before her surgery to reduce secondary injury. Now that we have an understanding of the framework, the risk factors, and injury prevention, we can reflect on how each piece is related and affects health-related quality of life. Now, what is health-related quality of life? It's the complete mental, physical, and social well-being of the patient or athlete, directly based on the perceptions, values, and independence. Now, take our example. If our basketball player has a risk factor for injury that are not the focus of injury prevention at the beginning of the stages of our model, that is, organ and origin, health-related quality of life will be affected at the latter stages, that is, societal and environmental. Now, to break that down even further, our example, if our basketball player has a risk factor, for example, altered squat mechanics or muscle imbalances, that are not directly preventable in the primary and secondary stages of injury prevention, perhaps her inability to jump will cause a lack of participation on the basketball team, which will directly relate to her motivation in school. Maybe she won't be motivated to graduate, which will directly affect her ability to get a job down the line. So in conclusion, as athletic trainers, we must prevent the deterioration in function in the early stages of the model by identifying risk factors and subsequently preventing injuries with primary, secondary, and tertiary injury prevention approaches to enhance health-related quality of life. Thank you, and here are my references.